our health correspondent, Catherine Da Costa, is with me. Catherine, I'm assuming you can say the name better than I can, but just explain for us what more do we know about this breakthrough?
Yes, aducanumab is an Alzheimer's drug that aims to slow down the progression of memory and thought problems in people early on in the disease. If approved, it would be the first Alzheimer's drug since 2003 and the first drug on the market that would target the cause of the disease rather than trying to ease the symptoms. Now, as you say, the drug is given as a monthly infusion and it targets amyloid, a protein that builds up in the brains of people with Alzheimer's, which is the most common form of dementia. Now, the treatment has a controversial history because a large trial of more than 3,000 people worldwide was stopped in March 2019 when analysis showed that the drug didn't provide any more benefit than a placebo. But later that year, the manufacturer Biogen looked at the data again and concluded that it did work if it was given in higher doses. Now, Biogen says it significantly slows a cognitive decline. Patient groups are desperate for treatments, and some of those involved in the clinical trials saw a difference. They said it did make a difference, but many doctors are still sceptical about the data. But we do need some good news because there have been about 100 Alzheimer's drugs that have failed in the last decade, and 50 million people living with dementia worldwide, and that's predicted to increase to 130 million by 2050 as populations age.
Okay, you mentioned the controversy. We were saying how regulators may give it approval in the United States. What reaction has there been to all this?
Well, campaigners say it's an area that's been hugely underfunded in the past, and we know that dementia is the biggest cause of death in the UK. It's one of the highest causes of death in the US. But we know that there's demand there, but so far patients haven't had a treatment. So the charity Alzheimer's UK says if it's approved today, it will be a historic moment, one that families have waited a really long time for. They think it could open the doors to more funding and research in this area to find more drugs for dementia in the future. But even if it's approved in the US today, approval in the UK and other countries could still be some time off.
Okay, Catherine, at the moment, thank you very much. Catherine Da Costa.